In 1970, I was invited to give a talk at the University of Michigan in Ann Arbor. John Jacquet, a professor of engineering there and one of the very early workers with computers in medicine, had a conference, the computer in the diagnostic process. And he asked me to give the opening talk. And I decided, this was 1970, and I decided I would give it on patient power, because I've been talking about it and things, but I hadn't really formalized this into a write-up. So I opened with patient power and then brought in my work with a computer interviewer, but argued that patients should be granted the right to make their medical decisions. It was important not to become doctors and not to become medically knowledgeable, but to be in charge of the value of their own value system, and it should be up to us as clinicians to communicate to the patient the best we can about the problems and the alternatives, and then the patient should be granted the right to decide which approach to take. And the word compliance in the medical literature, good patients comply, bad ones don't, as if it really was the responsibility of the patient to do what doctors order. I was saying that really to not take a medicine that the doctor prescribed is really a patient's First Amendment right and should be respected, but but that we have done our best to explain the reason for this prescription.